Good afternoon and welcome back. We really have a lot of information to share with you today, so we're going to get right into it. I wanted to let you know about the Board of Supervisors meeting that we held yesterday, where we took important action on our budget for this next year, and a lot of those issues we dealt with certainly were related to the pandemic and our response to it. Yesterday, our Board of Supervisors voted to adopt a budget of more than $5.5 billion, the largest budget we've ever adopted in the history of the county, and one that takes direct aim at many of the pressing needs facing our region during this pandemic. The budget includes $100 million to support our testing, tracing, and treatment strategy, or our T3 strategy, as we call it, to slow the spread of COVID-19. That money also will be used for food distribution, medical supplies, personal protective equipment, and shelter, among other uses. But we supplemented the budget additional resources to help people struggling in this pandemic. Supervisor Fletcher and I brought forth a proposal that builds upon the county's existing emergency rental assistance program and extends it countywide to support families struggling to make their rent payments because they've lost their job or seen their work hours reduced. The proposal provides $24 million in emergency rental assistance to low-income households for up to $1,500 per month for 2 months, with payments made directly to their landlord who have been impacted by this pandemic also. We want to avoid more homelessness, so this program has also included $1 million for landlord-tenant counseling services to prevent evictions when possible. If we can work with tenants and renters to reach common ground and avoid costly and messy evictions, it will certainly help everyone involved. There are a variety of other measures that we adopted to help families cope with the impacts of this pandemic, and Supervisor Fletcher will provide some more detail on those in his remarks. I want to thank him and my colleagues on the Board of Supervisors, Supervisor Jacob, Gaspar, and Desmond, for the spirit of collaboration that prevailed last night and led to the adoption of the budget. I also want to thank the many residents and community organizations who spoke last night and at previous hearings and provided us with valuable insight on the needs and the challenges they have been facing. Finally, just a quick shout out to our county executive team and staff for putting together a well thought out, complex budget while also dealing with the pandemic response. I would be the first to acknowledge that no budget is perfect, and we always wish we could do more, but this budget has a lot for everyone. It will allow the county to do more testing of our coastal waters in South County that are affected by cross-border sewage pollution. It will help us reimagine our mental health system, allowing us to expand our crisis stabilization units that can offer immediate help to people suffering mental health breakdowns during these uncertain times. And it provides funding for measures to address racial injustice that, as we've seen this week, continue to tear apart our nation. We are also helping others. We previously provided funding to local cities that didn't receive federal assistance, and yesterday we approved $5 million to expand testing for teachers, staff, and other school personnel at the K through 12 schools as they prepare for their potential reopenings. We're going to hear more about that today from the San Diego County Superintendent of Schools, Dr. Paul Gotthold, and I'll do a more formal introduction of him a little bit later. As I said, I know Supervisor Fletcher has more to touch on regarding the budget and the updates, so let me call him up at this time.
Thank you, Chairman Cox, and good afternoon. The unprecedented times we're in require unprecedented action to try and respond to the situation we face. And in our budget yesterday, we tried to do that with a focus on issues that would help us respond to the COVID-19 pandemic. Supervisor Cox mentioned the rental assistance program he and I brought forward, which is for those who have been directly impacted by that. In addition to that, our board approved $5.4 million to help facilitate the exit from the convention center. The convention center was stood up with the city, county, housing commission, regional task force on homeless working together. The county is allocating $5.4 million to provide mental health and drug treatment services for individuals who are finding permanent supportive housing as a result of the efforts of the City and Housing Commission moving forward. That, again, is partially in response to COVID and helping facilitate a successful transition out of the convention center for some. The other thing we approved that is directly related to COVID was $2 million in income replacement for workers. We often have situations where individuals are positive and need to isolate, or a close contact and need to quarantine. But because of their economic situation, they could fall through the cracks in available state and federal programs, and they're forced to make a choice between putting food on the table for their family or doing what we need them to do from a public health standpoint, not only for their own health, but for the community. These $2 million will be available to provide income assistance to individuals who would not otherwise be able to isolate or quarantine, and we think this is an important step forward. The county, as we've continued to work throughout COVID to make sure we are communicating to our residents in the language they are most comfortable, also allocated $2.5 million to continue to work to do better at providing the services, information, and forms in the threshold languages in hopes of facilitating better communication with the people who are in San Diego County. Another important point we took forward is trying to help bridge the digital divide. I want to commend all of our schools. Dr. Gothold, we've talked countless times about bridging that digital divide to ensure that as kids go back to school, the majority of them remotely, and even as some schools back online, there will still almost certainly be a remote or virtual component to their education. Our schools have done a great job in providing devices and tablets and Chromebooks and negotiating low-cost internet fees with some of our largest providers. But for many families, even the low cost is still a barrier too far to move forward. And so yesterday, our county approved my budget change letter to allocate $2 million to help bridge that digital divide for those families in need. We want every child to be able to access their education system, and this will help ensure that connectivity, and I appreciate my colleagues' support of this effort. I want to focus for a minute today on walking through the efforts that we're doing around school testing. Obviously, top of mind is the possible return to school if they choose. A number of elementary schools waivers have been approved. We also, assuming our case rate stays down through September 1st, schools will have the option of resuming a modified in-person learning environment consistent with the state guidance that has been put out. As a county, from a public health standpoint, we want to make sure we're helping facilitate the testing. There are strong recommendations in the California Department of Public Health requirement of testing of staff at school facilities. This is not just teachers, it is teachers and maintenance and bus drivers and administrative support staff. And so we want to make sure as a county, as we've allocated that $5 million to support this testing, that we are in a position to be able to meet the need of our educational staff as they prepare for a return to the learning environment. And so I want to walk you through what that's going to look like if we pull up the first slide on school testing staff. There you see California Department of Public Health recommends periodic surveillance testing for any school employee who may have contact with students or staff. What we're going to be doing is two things. One is making testing available at the over 20 county coordinated sites, including the 4 no appointment locations for anyone, including school personnel and youth over the age of 12. We are increasing our capacity to make sure that we are in a position to be able to handle the testing for those school-based personnel who need to get a testing. But in addition to that, and you'll hear from Dr. Gothold in a minute, we're working with the San Diego County of Office Education to open additional testing sites regionally that will be dedicated for school staff. These will be locations the County Office of Education will help coordinate. These testing locations will be available for any school personnel, whether they are a traditional public school, a private school, or a charter school. But these locations will be dedicated for the staff of our educational institutions K through 12, where they can go and get a test at no cost to themselves. Additionally, our county coordinated sites at 20 sites, those will also be available if they would prefer to go to those. But again, it will be testing available for all school personnel employees at no cost. We've gotten a number of questions about students, and I'd like to talk for a minute about student testing. It is not recommended presently that asymptomatic students or children get tested. But if a parent desires to seek out a test for their student, the first step would be consulting with your pediatrician or family physician. This would be your medical home. This would be the individual who can give you the best guidance and can help arrange your testing. If you don't have a pediatrician, a family physician, or a medical home, then we encourage you to call 211 San Diego, who can help get you enrolled in a medical home and get you connected to healthcare testing. We have worked with Rady Children's Hospital. This was announced many, many months ago on a regional collaborative where Rady is in a position to coordinate with all of our healthcare providers, with almost all of our healthcare providers in San Diego County to provide one centralized place for testing. And you see the contact information there for the COVID collaborative through Rady Children's Hospital. But again, the encouraging starting point is with your pediatrician or your family physician, and they can help coordinate testing through a centralized process with Rady Children's Hospital. The two exceptions to that are if you have your healthcare through TRICARE, they will handle their own testing, and Kaiser Permanente to date has not joined the regional COVID collaborative in partnership with Rady, and so if you are a Kaiser patient, you would need to contact them directly in order to facilitate a conversation about your testing options. Next slide here just represents some additional efforts we're doing around testing. The state of California has made about $20 million available in enhanced detection funding award. This is to expand testing, surveillance-related activities, contact tracing, and so we are going to be assessing the options of how best we can increase testing throughout our community and surveillance-related testing, potentially wastewater testing and other things, and we will have more details on this program and this effort as we move forward. Before we get into today's charts, I just want to take a minute to thank Dr. Gothold, to take the superintendents and principals throughout San Diego County who have worked very collaboratively with the county. We're doing everything that we can to try and facilitate and support a safe return to a learning environment. There's obviously great challenges surrounding this, and our schools have faced those and have dealt with those. I think we recognize the vital importance of education and the reality that 100% online is simply not an option for everyone. And so we're going to do everything we can to support our schools, and we appreciate their work and cooperation around efforts of setting up these testing programs for the staff of our educational institutions. We want to make sure that's available to all of them, and the efforts that we've taken to try and make testing available to the students of San Diego County. And we'll continue to work with them as we all go through this process together. But to Dr. Gothold and everyone, we're very grateful for their efforts and support, and we're pleased to partner with them. Let's jump into today's numbers. We'll go through these quickly. Today we're reporting 7,607 is our 7-day average of testing. Again, well in excess of our goal. Our percentage of positive, 3.6. And you can see our total tests reported there, just under 800,000 tests reported in San Diego County. Case investigations, 90%. Close contact, 87%. Again, very close. Our metric is over 70%, so we're meeting that. We have an internal goal of 90%, so almost there. And the treatment numbers on the right-hand side. The next chart we'll look at gives you an update on the testing times. We start sharing this once a week. It is vitally important that we turn around tests rapidly in order to get the full value of case investigations and contact tracing. Here you can see our last 7-day average hospitals, their average turnaround time, you see right there, of 1 to 1.5 days. Our public health lab between 1 and 2 days. The segment of our county public health operations that are part of our Helix partnership are between a day and a half. You see the state's walk-in Let's Get Checked lab, a little bit more of a lag there. Our FQHC clinics have come down significantly in their testing times, and commercial labs still at 4 to 6 days, longer than what we see in our labs, but again is coming down. And it's important that we align the testing capacity that we have with the need and recognition that we need to turn around these tests quickly in order to have them be effective, and we continue to work daily to meet that threshold. Today's totals, we're reporting 228 positive cases out of 8,327 tests total for a 3% percentage of positive. Again, the purple line there reflecting the 14-day rolling average, which has stabilized a bit but continuing to trend in a good direction. Our daily hospital census, you'll see ICU COVID-related up just a little bit, total COVID hospitalization up just a little bit, but holding relatively stable to where we were about a week ago. And again, we'll see some day-to-day fluctuations as the broader trends we're looking at. Total hospitalization, our total census, you see the COVID numbers there at the bottom, 309. Total hospital census today, 4,290. Again, holding remarkably stable and flat below that 80% threshold and metric we have for COVID. And then final chart is our ICU capacity. Today you see the 104 COVID-related. 366 is our total ICU system capacity for a percentage of 67% again, holding reasonably stable and flat. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her Public Health Officer's update.
Thank you, Supervisor Fletcher, and welcome everyone for today's briefing. As usual, all of our global, national, and state statistics are based on data that we pull from the Johns Hopkins dashboard and was obtained today approximately at noon. Today's local statistics in San Diego County are from reports as of 11:59 p.m. yesterday, which is last night, Tuesday. Today, there is a total of 37,222 cases, which is 228 more cases than yesterday, and this is a decrease in the number of daily new cases compared to yesterday's report of 267 new cases. The overall total number of cases includes 666 deaths, 3 new deaths reported since yesterday. And on this next slide, this is the demographics for all of the cases. The age range remains unchanged, 3 months to 102 years of age. The age groups from 20 to 49 years of age represents 59% of the total number of cases. Females represent 51.5% of the total number of cases, and males 48.5%. And there's 102 individuals for which no gender information is available or identified. Now, 8% or 3,022 of the cases have been hospitalized, and of that number, 738 have been admitted to the ICU, and this number is 2% of the total number of cases and 24% of the total number of those hospitalized. On this next slide, this is our traditional epi curve, which shows our progress with the decreasing daily number of cases since state restrictions were imposed on July 3rd and were effective for San Diego County on at midnight, July 15th. And here we can see the progressive decrease in the number of cases with these restrictions. Our challenge is how to slowly open back up without driving these cases back up, and we will hopefully have more guidance from the state and more directions and guidance for other sectors besides schools in the coming week. Now, this next slide reviews COVID-19 demographics related to overall hospitalization. The majority, or 71%, which is 2,150 of the total number of those hospitalized, are 50 years of age and older. So as you can see in the overall number of cases, the majority of the cases are in the 20 to 49 year age groups, but when we talk about hospitalizations and even with the deaths, those are individuals that are 50 years of age and older. Now, males represent the majority of hospitalizations at 54%, and Latinos or Hispanics represent the majority of hospitalizations at 62%, which is 1,744 cases. In the next slide, we will drill down further on deaths. This number represents 1.8% of the total number of cases, which is also the county's case fatality ratio. Of the deaths, 288 or 43% are female, 380 or 57% are male, and 641 or 96% of the total number of individuals that have died did have underlying medical conditions, and 27 or 4% of the total number of deaths did not. For a review of the underlying medical conditions for our individuals that have died, you can go to our website and look for the COVID Watch, and on page 8 there is a description of the types of underlying medical conditions for those who have died. And as always, our sincerest condolences and sympathies go out to the families and friends of those individuals who have lost their lives due to COVID-19. Next, I'd like to discuss a summary of all of our outbreaks. Since the beginning of the pandemic, 385 total outbreaks have occurred in 3 categories: skilled nursing facilities, or other non-skilled nursing facility congregate settings, and then community settings. And of the 384 outbreaks, 265 or 69% are currently closed or inactive outbreaks, meaning there have been no new cases in these settings for the last 14 days or longer. This leaves 119 or 31%, which is approximately a third of all of the outbreaks confirmed, that are active. And of these 119 active outbreaks, 28 or 24% are in the skilled nursing facilities, and there are 86 in San Diego. In this setting, there have been 830 residents and 553 staff members that have been diagnosed with the laboratory-confirmed COVID-19, and this includes 156 deaths. 31 or 26% of the 119 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 758 residents and 587 staff members reported, and also includes 108 deaths. In the last category, 60 or 50% of the 119 active outbreaks are in our community setting locations. In this next slide, all 224 active and inactive community setting outbreaks since March 25th are stratified by month. And this includes 1,601 cases of community setting outbreaks since March. Note that July has the largest number of outbreaks with 93 of the 224 community setting outbreaks. Keep in mind only 60 of the 224 community outbreaks are now currently active. In the next slide, this shows all 224 outbreaks by types of community settings. The top three of the 224 outbreaks includes 59 that, well, actually, the far left, restaurants. 13 in just restaurants and restaurants/bars is 57. So that's the top group. The next would be in businesses at 59 outbreaks, and then the third is in healthcare settings. Again, since March, the total community outbreaks have produced 1,601 laboratory-confirmed cases, including a total of 12 deaths. Now, let's move on to our triggers. As everyone is aware that we have 13 triggers, we're going to talk about 2 today. Trigger number 1, which is case rate, because that has an impact on our schools reopening, and we have recently, last week, as of last Tuesday, we were off the state monitoring list. And then we will talk about community outbreaks. So trigger number 1, again, case rates, continues to be in the green and is below 100 per 100,000 population. And today our case rate, as calculated by the county, is 81.4, and by the state, 80.2. In the next slide, as a reminder, we have shared this information previously, but we just want to remind everyone and walk through the process of how it was determined that we came off of the state's monitoring list. So you would have to be off the state's monitoring, well, at least have 3 days of non-elevated data. And then on the 4th day, that will begin day 1 of a 14 period. And after that 14 period, on the 5th day, schools K through 12 could open for in-person education if they chose to do so. In this next slide, this actually provides the actual dates where we were in our 3-day non-elevated period, and then on Tuesday, August 18th, that was the first day of our 14 days, and if we continue in the trend that we are now, below 100 cases per 100,000 population, as of the next slide, as of September 1st, K through 12 could begin, schools could begin in-person education. Again, this is contingent on our case rate remaining below 100 per 100,000 population through August 31st. Now, in addition, coming off the state list also means that institutions of higher education can also be open and should follow the state guidance that was issued on August 7th. And I would just again like to extend an enormous thank you to everyone, all of the various sectors, individuals, for the great work in helping us to achieve the monumental task of coming off the state's county monitoring list. So we want you to keep up the great work and continue those efforts so we can continue to not be on that list. Now let's move to trigger number 2, which is related to community outbreaks and is abnormal and in the red. Today we are reporting 20 total community outbreaks for the past 7 days, from August 17th through August 25th, which represents 75 cases. Overall, in the next slide, this represents all of the 20 outbreaks by type of settings over the past 7 days, and this includes 8 businesses, 1 faith-based organization, 2 grocery/retail locations, 1 in a gym fitness facility, 2 in a healthcare setting, 1 in a hotel, resort, or spa, and then 1 in a restaurant only, and 4 in restaurants/bars. Today, 1 new community outbreak was added to this list, and this is in a business. In closing, I would like to stress that this pandemic is not over yet. Every one of us has a tremendous role to play in our collective regional success to get through this pandemic. And keeping up the momentum will require that all of us follow the best practices that we issue every day in our news advisory. And that these strategies include washing your hands and promoting sanitation practices, staying 6 feet apart from others, wearing a facial covering, avoiding crowds and large gatherings, and obviously staying home if you are sick. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. I wanted to correct one thing that I said earlier. The county budget for this next year that was just approved yesterday is $6.55 billion, and it is the largest budget in the county's history. You know, as was mentioned earlier, we have a very special guest with us today, and that's Dr. Paul Gotthold, who is the County Superintendent of Schools for the County of San Diego. In that role, he works with all 42 different school districts and their superintendents, and I have to tell you, he's been a great partner as we've been working with the schools and trying to deal with this pandemic. And at this time, I'd like to call him up to kind of talk about a little bit about some of the things they are doing with the schools and the reopening of schools in the near future.
Good afternoon, everyone. Thank you, Chairman Cox, and thank you again to the Board of Supervisors for all of your leadership during this time. Just in reference to the digital divide, the $2 million that Supervisor Fletcher had mentioned, you know, we have a number of children that are still not connected. We've been working since March to get them connected, and this is going to go a long way for our families in need. We believe that connectivity doesn't extend just because we're in a distance learning environment. It's a basic need, just like power, water, everything else. It's going to help families to be able to get in front of, not have to go to the local library to use the resource to be available to their home. And so we're excited about the prospects. Even as early as next week, we will have thousands of families connected because of this new plan that will be able to provide the support directly from money that's been allocated. So thank you for that. Ever since schools made the decision in March to close campuses to prevent the spread of COVID, we have been focused on creating plans to reopen safely. An effective testing strategy is a key component of one of those plans. San Diego County Office of Ed is proud to partner with the county and local schools to develop an approach to test school employees. With more than 80,000 school employees in the region, this is obviously a huge undertaking. San Diego County is home to 42 districts, 127 charter schools, and nearly 200 private schools. Given the diversity of our schools and the size of the county, Specifics of testing plans, timelines, and logistics will vary. What won't vary is our commitment to ensuring healthy environments for our students and employees. With a task of this size, we know we must be flexible and adapt as we go. And that has been made much easier with the support of our County Board of Supervisors, which has allocated funding to make this effort a reality, and our partners in public health. Adding testing is just another tool in our COVID toolkit, along with hand washing, wearing face coverings, continue to implement physical distancing practices. All of these are important steps for our region and schools. I think it's safe to say, and on behalf of all of our schools in the county, this has been an incredibly difficult time, and we miss our school communities, we miss our children and teachers and classified staff. And it's been, this back to school is really just like no other. It just hasn't been the same. But by working together and prioritizing the health and well-being of our school communities, we know that we will emerge from this stronger than ever. Thank you.
Thank you for being with us today, Dr. Gothold. We'll go straight to the questions now, and let's go ahead and call up the first one.
The first question is from Ginger Jeffries with KUSI. Please state your question.
This question is from Ginger Jeffries with KUSI. Hi.
Hi, apologies, Ginger had to step away.
So do you have a question?
Hi, casinos have found success with the safety measures they put in place to prevent the spread of coronavirus. Would San Diego County recommend to the state that these safety measures be implemented by other businesses ready to reopen?
I'm going to ask Dr. Eric McDonald to respond to that.
Dr. Wooten.
Hi, this is Dr. McDonald. That's a great question. I think that actually the guidance that the state has given to businesses on the appropriate plans to follow to minimize the risks of COVID in their environments are excellent. And I know that actually our local tribes have used some of those templates to actually design the programs that are on their tribal lands at the casinos. I think that it's important to note that there have been some cases of COVID who in the 14 days before they had the onset of their illness actually, oh, sorry? Okay, I'll go ahead. Yeah, no, there have been cases who in the, who are San Diego County residents who in the 14 days prior to the onset of illness either were at a casino as an employee or a patron. And we don't report on those cases. We work with the tribal public health authorities to investigate them. And because the casinos are on tribal land and are in their jurisdiction, details of cases should be directed towards them, just as we work with our military partners for any cases that are on military bases, or we work with our colleagues in Mexico for cases that are going back and forth across the border, and we work with our neighboring county jurisdictions in Orange and Imperial, et cetera, when we have individuals who are in both jurisdictions. So I hope that answers the question.
Okay, we'll go to the next question.
The next question is from John Wozen from the San Diego Union Tribune.
Yes, thank you. Two questions from me. The first regarding a recent CDC kind of update or revision to their guidance around people who are asymptomatic, close contacts of those with COVID, not necessarily needing to get testing. So I guess the question would be, does that change in sort of any way, shape, or form the county's guidance around who should get tested and under what circumstances? Does it change, you know, sort of what tier asymptomatic close contacts fall into? And then second question, related but not directly, is in what way does the state deal that was announced with Perk and Elmer earlier today, how is that going to impact San Diegans in terms of the amount of tests that will be done and who might be able to get tested? What's the impact going to be for San Diegans?
Okay, Dr. Wooten's going to respond.
Thank you for the question to clarify information about testing guidelines and additional efforts that are being conducted by the state. We appreciate any guidance that we get from the federal government as well as the state. We do not see that the guidelines that were issued just yesterday will have an impact on our operations in San Diego. If you'll notice in the guidelines from CDC, there is language about jurisdictions looking at what their available resources are, and we feel that we have based on our available resources, we issued our priority testing document last week, I believe. Yes, we issued a KHAN last Monday, and so that is not going to change. Our first two priority levels are focused on symptomatic groups and individuals, and then the second two on asymptomatic groups and individuals, and the fifth on surveillance. So the CDC's guidance that was issued on yesterday is focused on symptomatic, but it will not change what we will do locally. And your second question?
Yes, the second question was regarding the deal that the Governor Newsom had announced earlier today with Perky and Elmer to expand testing in the state of California. And basically the question is, what does that mean for San Diegans? You know, how many more tests might we be able to do? Is this going to change sort of how many people or who can get tested? What's the impact going to be for people here?
Well, I look at that partnership as an expansion of capacity for the entire state. And the state has provided state testing sites here in San Diego as well as other counties throughout the state. So if we expand additional or add on additional state testing sites, I think this provides an opportunity for a quicker turnaround time for tests that are performed at the county sites and performed at the sites where they send those tests for processing. So I think this is a great service and resource to the entire state, and as available, if we get additional county, or rather state test sites, we would benefit from that partnership. Thank you.
Okay, but not necessarily, we don't necessarily know with 150 more thousand tests a day, how many of those would be in San Diego County. Maybe too early to really say that.
That was specific to that partnership, and I think it's too early to say that. If we get more state testing sites, that will be part of that increased testing.
Okay, thank you so much.
Next question, please.
The next question is from Brandon Lewis with CBS 8.
Thank you. Can you lay out some of the criteria that's necessary to keep schools open beyond September 1st? Is there a number, perhaps the case rate that parents can monitor to see if schools may have to close again once they potentially reopen on September 1st?
Okay, Dr. Wooten's going to respond.
Thank you. That question speaks to the metrics and of what would be happening in the community, and the state is still working through the specifics for that, but I think I mentioned previously that tiered approach is being looked at, and based on what that tiered approach looks like and what our metric numbers are, now that's one thing that could have an impact. But right now, what we know today is that once schools open, and even if we get back on the monitoring list, schools would continue to stay open, and closures would be predicated on outbreaks. So that's what we know today. But in terms of, because the monitoring list as it exists today may indeed change. So I think it would be premature and unwarranted to speak about what would happen in the next months if we don't have the same system. But what we know today is that once schools are able to open on the 1st, if we continue, that's predicated on if we continue to have a case rate less than 100 per 100,000 population, if that continues through next Monday, then on Tuesday, schools would be able to open if they choose to do so. Dr. Gatto?
Thank you, Dr. Wooten. As it pertains to individual school sites and districts, the state has put forth a measurement of 5% of a classroom. So if you're talking about pods of kids in small groups, this could just mean one positive case, either students or staff. That classroom would automatically shut down for 14 days. If you're talking about an individual school, 5% again is the metric. So if there are 5% positive cases identified in one school, that entire school needs to shut down for 14 days. And when you're talking about a district, 25% of the schools that fall into this category would warrant a closure of districts.
Thank you, Doctor. Dr. Galvo, could you touch a little bit more? I know you talked about all the districts with private schools and charter schools that are all having their own systems here, and your office is kind of working to manage all of that. So can you talk a little bit about the guidance that you are giving to some of these districts, and for parents, how you're working to avoid this getting too unwieldy, where one district has one policy that's so close to another district?
Yeah, so again, our office provides oversight and support, but the ultimate decision to bring kids back in open schools rests with that local school district. So we want to make sure that schools are prepared for any contingency, that they're following the health measures, and so everything that we've done since March to develop our criteria and guidance around safe reopening of schools has been done in conjunction with public health. It follows those metrics. So we would basically just put some assumptions forward. What does your school look like if 50% of your kids are on campus, 30% of your kids? How are you going to deliver a hybrid level instruction? How are you going to accommodate all of our children's needs under an imperfect environment? So when you look through our guidance, it really is a checklist of how to do certain these things to effectively open schools and provide education for our kids. So it's a menu of options, if you will. We also made clear that we wanted to make sure that our districts could provide distance learning, because we know a lot of our parents, irregardless of what's happening right now, still want to continue to keep their kids at home. And we wanted to make sure that we provided options, we were prepared for those options. And again, this is just guidance. The ultimate decision rests with our local school districts.
Thank you all very much.
Hi, I'd just like to also add, if you would go to the county's website on coronavirus and look under the school sector, the requirements that the state impose for the elementary school waivers, there are 14 elements. And in reviewing the applications that were submitted, whether they were districts, whether they were districts, private schools, or charter schools, each of those safe reopening plans had information about those 14 elements, and that's really what's important, whether it's what provisions will be made for social distancing, for distance learning, whether or not someone became ill, or whether or not parents want to keep their children at home and not send them to school, face coverings, as well as movement in the school, entrance and egress, health screenings, as well as communication and testing. So all of those elements are outlined on the website, and those are the things that are included in the safe reopening plans of the schools that help to keep our children and our staff members safe. Thank you.
Thank you.
We have one final call-in question.
And the last question will be from Matt Hoffman from KPBS.
Good afternoon. Sort of following up on what Brandon was talking about. What should parents be expecting headed into the school year as it relates to in-person instruction? I mean, like the possibility of temporary closures, like every few weeks if there's an outbreak. And would parents know if there's an outbreak if it's less than 5% of the school population, or only if you deem it necessary to notify?
Okay, I think Paul Gothold is going to come up and respond to that. County Superintendent of Schools.
You know, we've been encouraged all of our schools and districts to over-communicate during this time with our parents because of the uncertainty, and truly there is not a playbook for this. And so having said that, we know that there will be a case that occurs where a school might have to pivot And it's critical that the school district principal are communicating those changes with their school communities, with their staff. What I would say, there's probably about 8 to 10 districts in the next 2 weeks to a month that plan on reopening if the county does continue to stay off the watch list. And I would also say that even though we have a county metric of less than 100 for 100,000 cases, that is not the story for some of our communities. The case rate may be much higher. I know that school districts and principals are analyzing the community spreads and the effect on their own school communities because it doesn't necessarily reflect the county average. And all of those things have to be taken into consideration as well. So depending where you are in the county, it's a very different story just based on the circumstances we're in today.
Gotcha. And I know that health officials, you all say that the virus is widespread. So assuming there is an outbreak once schools get back up and running, how does contact tracing work for kids? Like, do you need parents' permission to speak with students? Are there any difficulties you foresee there tracking the virus in schools, whether it's teachers or students?
Hi, I'll tackle that question because those contact tracers work in our epidemiology branch. We've actually set up a team in the Epidemiology and Immunization Services branch. Some of them are actually former school nurses, and with them we'll be working some contact tracers, and we will be working with the parents and with the staff at the schools to do our contact investigations. It is a bit of a unique environment because of the minors that are involved, but we have been working with pediatric or cases that are children actually throughout this epidemic, so we are following our own policies and procedures about getting information from parents to be able to do effective contact tracing. The systems that are being set up in the schools so that there are cohorts of children that are known to be learning together will make that a lot easier. Again, we do anticipate that there will be some cases that show up in schools. So we are doing the planning now so that we can effectively and quickly investigate those.
And just one other point of clarification, because I'm confused. So if we do jump over that 100 per 100,000 residents after schools reopen, does that erase all the progress and schools all have to shut down within the county? Just looking for clarification there.
No, the answer is no. Again, it's good that we're focusing on that number of 100 per 100,000, but as the superintendent, just mentioned, there are different pockets of the county that have higher rates. And even where we are now with at 80 per 100,000 is higher than we need to be and higher than we should be. That's still moderate to significant community transmission. We need to be well under 25 per 100,000 to be really what I would consider to be headed towards normal. So we have a long way to go, and I want to emphasize what Dr. Wooten said, that we need to keep at this and be diligent over a sustained period of time to keep our schools safe and open, to keep our businesses safe and open, and to get this outbreak under control.
Thank you.
That completes our call-in questions. We have one text question that deals with the testing at schools, and Supervisor Fletcher is going to respond to that question.
Jeff McAdam from Fox 5 has several questions. He wants to know, will students only be tested if they are symptomatic? No regular plans to test? And what is the threshold in which this county would look to shut down schools once again?
Thank you, Jeff, for the question. Your second part of the question was just answered before you sent in your text question, so I think that's been covered. The recommendation on testing for schools is that school staff, teachers and all staff be tested regularly, and that's where we're increasing our capacity at our county-sponsored testing sites, 20 of them, and we're working with the County Office of Education to set up regional hubs that will be dedicated testing for school staff. As it relates to students, it's not presently recommended that asymptomatic students get tested. If a parent would like to get their child tested, we recommend they start first with their pediatrician or family physician. If they don't have a pediatrician or family physician or medical home, then they can call 211 who can help arrange that. Many months ago, we stood up and announced the Rady COVID Collaborative for Kids, which is testing for children throughout San Diego County. And we shared that information. So if a parent really wants to get their child tested, even if they're asymptomatic, that's something that is doable and achievable. They would need to go through their doctor and then coordinate that with Rady to get that testing, unless you are at a TRICARE, in which case you would have to go through your system, or if you're Kaiser Permanente, who is not a part of our regional collaborative, then you'd have to contact Kaiser.
Well, that completes our calls for today. We want to thank you for your participation. This is our last scheduled media briefing for this week. We're going to return on Monday at 2:30. However, I want to remind everyone that our communications office will continue updating our media website, and our coronavirus website will continue to be updated, so please check it for the latest information. Lastly, I know that the weather is great and it's summertime in San Diego, but as you go out this weekend to enjoy the beaches and the parks and wherever else you may go, please don't let your guard down. Remember that coronavirus is still out there, it's still with us, so we need to continue wearing our facial coverings, maintaining social space, and avoiding large gatherings. So please be careful, San Diego. We'll see you next week at Monday at 2:30. Thank you.